Hi everyone, so this is Dr. Farida Rajan Ibrahim Omasundi, and today I just wanted to have a continuation. This is a brief discussion on cervical cancer, and today we are going to look at the signs and symptoms. So remember, we said cervical cancer is a type of cancer that arises from the cells of the cervix, it being sexually transmitted and the cause being human papilloma virus. And we previously looked at the risk factors. So coming to the signs and symptoms, the first you have to know that sometimes you can't present with any symptom. So in its early stage, cervical cancer can be asymptomatic. But as you're advancing, you can have abnormal vaginal bleeding, that's intermenstrual bleeding, postcoital bleeding, or heavy periods. When you're on your period, you find that you are heavily bleeding. So that's that on abnormal vaginal bleeding. So you can also have abnormal vaginal discharge, where you see watery discharge. It can be bloody, and sometimes it's even foul smelling. So if you have those discharge, you have to suspect cervical cancer. And sometimes you find that you have pain or discomfort even when having sexual intercourse, or after sexual intercourse you might be experiencing pain. And sometimes this patient will come in complaining of pelvic pain. They can come in complaining of back pain, and as the disease is progressing, you find that these patients can also have urinary retention, where you are unable to fully empty your bladder, or you are unable to empty your bladder at all. And sometimes you can have hydronephrosis, sometimes even leg edema, sometimes even back pain. So sometimes you find that these patients will be experiencing back pain. So those are just some of the signs and symptoms that you might find or see in cervical cancer patients. Look out for more videos. Make sure you share, you follow, and you like. Thank you.